My name is Michael Gonzalez. I'm the founder of the firm and have really focused on bringing key people from the 340B space, particularly health centers, onto our team to help support you through our services. Our monthly 340B coordinator service is the largest line of service that we offer at our firm. And the cool thing about it is it actually came around by request of our health centers. So our clients that we were doing annual audits for realized that they needed more help than just coming in once a year and testing their program. So now what we do is we work hand in hand with them to make sure that we are fulfilling all 340B needs. Our core services within the 340B coordinator program are internal audits, financial analysis and review, e-prescription review, ESP uploads, and optimization of your 340B program.
So core to our monthly service that we have for our clients is monthly internal audits. This is a place where we see covered entities really struggle to get them completed on an ongoing basis. See, a lot of covered entities are really good at getting started, maybe getting them done for a couple months, but then as soon as anything happens in the health center, those resources are pulled to support other areas, and the internal audits aren't being conducted at the frequency that they should be. One of the reasons that this is important is that the TPAs, or third-party administrators that work with your contract pharmacies, often only allow you to look back so far when you're correcting claims. For most of them, it's a 90-day look-back window, but for some, it can be as short as 30 days. It's one of the reasons why it's really important that you're checking on a monthly basis that your prescriptions that you're qualifying through your contract pharmacy programs are actually eligible and meeting the 340B program requirements. So as far as our monthly service goes, when we conduct internal audits, we look at a variety of different areas. We're looking to make sure that we are following the 340B statutory requirements. So making sure that each prescription is 340B eligible, complying with both diversion and duplicate discount prohibitions. For each of the prescriptions we review in the monthly internal audit, we tie them back to HRSA's patient definition, making sure that we're able to demonstrate 340B eligibility. So we're looking to be sure that they are associated with an eligible 340B site, that we can tie them to your prescriber, or in the event that it is written by a specialist, that there's a referral for consultation present in your medical record, and we're able to demonstrate ongoing responsibility for care. We're also making sure that there are auditable records that would be consistent with what the HRSA auditors are looking for in the event that you are selected for an audit. And then the final component that we are checking is making sure that Medicaid duplicate discount has not occurred. So for each prescription, we essentially take them through all of the test points that the HRSA auditor would go through. Another component of the monthly internal audit is making sure that for all claims that were processed in the month, that we test for Medicaid duplicate discount. The way that we accomplish this is by looking at the billing numbers that were used at the pharmacies to see if any of the BIN PCN group numbers, or the pharmacy billing numbers that the prescriptions processed under, are within a national database of Medicaid fee-for-service and MCO plans. We do a lot of work on the month-to-month basis, maintaining this database, working with other partners across the industry, and working directly with Medicaid agencies in each state to ensure that we have an accurate and up-to-date database, and that we are able to identify if any claims are processed inadvertently, and then work with the TPAs and contract pharmacies to get those claims reversed and corrected, and then also have those plans blocked appropriately. An area where we often see compliance concerns within our monthly internal audits is when prescribers are also patients. So this is something that we target in our reviews on a monthly basis. So our team goes in and actually reviews all of the prescriptions that were processed in the month at the contract pharmacies or in-house pharmacies, and identifies if there are prescribers in the data set. And for those prescriptions, we test 100% to make sure that the documentation is there to support 340B eligibility.
With the financial analysis process, we're helping you with journal entries, right? So accounting is always a mess with 340B, especially contract 340B. And you have so many different vendors that report differently to you. There's different replenishment models. You know, there's instances where pharmacies pay you upon dispense, which is right when they let the prescription go. Now they owe you money. And then there's instances where you pay upon replenishment. And so that they actually don't owe you any money until you put the drug back on their shelves. And so by mixing all these different inventory types or replenishment types, it can make the accounting pretty difficult. And so we use kind of our skill set here to make sure that we have that under wraps, and you have great books when your accountant comes in and does your review each year. I think reviewing your e-prescription data is one of the biggest areas that people really miss out on, because if you think about it, you can only capture what you write in the 340B program. In most cases, obviously there's some nuance to referrals and stuff of that sort, but by reviewing all prescriptions that we write and where we're sending those prescriptions to, we can identify areas of opportunity, whether that be additional contract pharmacies, whether that be prescribing habits within our providers. It just gives us a lot of knowledge of what prescriptions are available to capture. And then we can try to figure out on the other end, how do we capture those prescriptions in our 340B program? ESP uploads and support is something that we actually include in our monthly service. So if a health center is ready to start submitting that data to ESP and participate in the additional savings that they can generate in their program, we take that burden off your shoulders, right? We're doing the uploads. We work with the manufacturers, the wholesalers, and your TPAs to make sure pricing gets turned back on and help you maximize your program. So optimization is really key to following through with the intent of the 340B program. So the intent is to stretch scarce federal funds of our safety net providers. And so if you really want to stretch those scarce federal funds, you want to optimize the 340B program. By doing so, we're able to follow through with our mission of serving our patients.
For each of the pharmacy locations, we pull utilization-based financial data. And so this really serves as an indicator for how your 340B program is doing. I like to use the analogy of a weather forecast. So what it's going to do is help us understand how the program is operating over the month. It's going to give us insight to the performance and whether or not pharmacies are operating the way that we expect them to. While the financial forecast that we provide you does not necessarily align with the payments that you receive from your TPAs, what it does is allow you to keep a close watch on your 340B program's function. We have seen that the forecasting that comes from this financial modeling has given us the opportunity to identify when there were issues within the contract pharmacy operations well in advance of the TPA even being aware. We've identified things like the pharmacy switch changed, and what that meant for the pharmacy was that the claims actually stopped flowing to the third-party processor. So we saw that before the TPA even realized that they were missing the data. And so it's really great for us to be able to help the covered entity keep an eye on their programs. Optimization within the 340B program is so important. One of our focuses is making sure that each of our health centers has their program set up just right for them. And that changes on a monthly to yearly basis. So we're always looking to see, are they partnered with the right pharmacies in their area? Do they have an opportunity for opening up an in-house pharmacy based on their patient mix and their clinic size, their prescriber volume? We really want to make sure that we're supporting the covered entities to optimize their programs individually. One differentiator within our service is that when we help clients with optimization, we don't charge that on a percentage basis. It's included in our monthly service. For instance, if we're working with you to identify what are areas of opportunity, that's just part of us being a good partner for you.
If you have any questions, feel free to reach out at FQHC340B.com.